from the Catholic University, and I will talk about the early inhaled budesonide for the prevention of the bronchopulmonary dysplasia. The definition: the systemic glucocorticoids reduce the incidence of the bronchopulmonary dysplasia among extremely featured infants, but these may compromise the brain development. The effects of inhaled glucocorticoids or outcome in these infants are unclear.
Hi, and welcome to Rapid Respiratory Review. Today we're going to talk about BPD, or bronchopulmonary dysplasia. So what's it caused by? It's caused by positive pressure ventilation, endotracheal tube being in too long, and prolonged exposure of differing amounts of FiO2. And it's typically seen in patients with RSV, and it was previously known as chronic lung disease. So what makes you more prone to BPD? If you have a PDA, a patent ductus arteriosus, poor nutrition in utero, family history of asthma, and fluid overload in the first few days of life. So how will it present? You'll see radiological changes, which go through 4 different stages, and these stages were more common before 1989, before the development of surfactant. Now that there's surfactant, it changes how these patients look on X-ray. So, we won't talk about those 4 stages. Clinical presentation, those present with pulmonary hypertension, poor tolerance to feed, tachypnea, retractions, and nasal flaring. If they're less than 2, they may be readmitted with RSV since they're really, they have more prone to getting infections since their airways are compromised already and they don't have the ability to exhale or inspire properly. And prevention of BPD would be go as low on your FiO2 as you can just to maintain the same sats, and use low volume ventilation. The treatment? Treat with what causes.
The application with the medicine. One remains astiquinine 863 infants, and early inhaled budesonide or placebo until they no longer require oxygen and positive pressure support or until they reach a postmenstrual age of 32 weeks and 0 days. The primary outcome was death or the bronchopulmonary dysplasia, confirmed by means of sterilized oxygen regulations for monitoring and postmenstrual age of 36 weeks.
We use oxygen in little tiny babies properly. There was some concern. Can oxygen do any damage to the lung of the baby?
Very high levels of oxygen actually can cause damage to the lung by way of oxygen overdose. That's particularly important for children who are born prematurely and whose lungs are not very well.
Is there a name for this particular condition?
That condition is known as bronchopulmonary dysplasia.
Okay, is this permanent damage? Does it get better in time?
It tends to get better over time, but if you check the lung function of children born prematurely, when they're 30 or 40 years old, then you still can see very subtle defects in the air flow.
They would act like almost like an asthmatic first year.
For the first year or two, it's not uncommon for them to actually have a lot of asthma types of exacerbations. Most of these children do get better when they get older, but as I mentioned, even decades after they're born, you can often see very subtle defects in their lung function.
correct. The incidence of the bronchopulmonary dysplasia was 27.8% in the budesonide group versus the 38% in the placebo group. The death occurred in the 16.9% and the 13.6% of the patients, respectively.
Autumn was actually born at 26 weeks. She weighed 1 pound 6 ounces, and she was on and off the ventilator till now. And she has what they call BPD, which is chronic lung disease.
She literally would turn blue in front of your eyes. One of the things that we do the first day that they come here is we assure them that their child's going to make it. We are going to get them and their child through this.
They have a special unit here for BPD, which drove us here. It's exactly what she has, so we wanted her to get the best care for that. It is a 6-hour trip for us, but we feel right at home.
What the Comprehensive Center for BPD does is changes the way we ventilate these babies, changes the way we care for these babies, and makes it so that they can be comfortable all of the time.
When we came here, within just a few weeks, she was a completely different baby. She is the happiest baby now. She can breathe easy.
Everything we learn here helps children everywhere. We have very smart scientists at the bench learning about these things at a microscopic level, and then we translate that into new and different care practices. We're trying to fundamentally alter the prognosis for this disease. That's our vision. That's why we do this. We want to help every single baby.
We really appreciate everything they've done for us here. We'll be ready to go home when she's probably 11 months old, hopefully before her first birthday.
Patients like Autumn often have to spend months to even a year or more in the hospital. That's time well spent, because what it does is lay the foundation for a normal childhood and a normal adulthood. Using the techniques that we've developed here, Autumn actually does very well. She's bright-eyed, she's beautiful, she interacts great with her family, she's a joy.
As a mom, I hope that Autumn learns how to ride a bike, just normal childhood things that everybody wants for their baby.
The proportion of the infant who required surgery, closer of the patient ductus arteriosus was longer in the budesonide group than the placebo group, as was a function of the infant who required reintubation. The rate of their neonatal illness and adverse events were similar in the two groups.
Okay guys, let's start with the bronchopulmonary dysplasia. Let's give a quick start. Bronchopulmonary dysplasia is a form of chronic lung disease that develops in preterm units treated with oxygen and PPV. Bronchopulmonary dysplasia results from various factors that can injure small airways and that can interfere with alveolarization, that is alveolar suppression, leading to alveolar simplifications with reduction in the oral surface area of the gas exchange. The developing pulmonary musculature can also be injured. Alveolar and lung vascular development are intimately related, and injury to one may impair the development of the other. Damage to the lung during the critical stage of the lung growth can result in clinically significant pulmonary dysfunction. Premature birth and subsequent events, exposure to oxygen, mechanical ventilation, inflammatory agents, likely shift the balance on the lung development consisting of lung alveolar and vascular growth to one of the premature maturations, which is associated with an arrest in the development and a loss of future gas exchange area. However, the alveolar maturation might facilitate gas exchange in short term. Infants with the bronchopulmonary dysplasia or the BPD have abnormal findings on the physical examination, chest radiography, pulmonary function testing, and histological findings. Initial findings observed shortly after the birth are consistent with the respiratory distress syndrome audience. Persistence of these symptoms can be associated with increased risk of bronchopulmonary dysplasia. Okay guys, physical examination may reveal tachypnea, tachycardia, increased work of breathing, that is with retraction, nasal flaring, grunting, frequent desaturation, significant weight loss during the first 10 days of the life. Infants with a severe bronchopulmonary dysplasia are often extremely immature and have very low birth rate. Their requirement for oxygen and ventilator support often increases in the first weeks of the life.
The conclusion. Amongst early preterm infants, the incidence of the bronchopulmonary dysplasia was lower among those who received the early inhaled budesonide than amongst those who received placebo, but the benefit may have been gaining and the expense of the increase in mortality.